What's up guys, Adam here from Kinetics Physiotherapy. This video is going to cover some exercises that you can do if you have a sudden onset of lower back pain, which is more muscular related, to try and get on top of an acute flare-up. Now with all of these videos, make sure you get assessed before starting any exercises. These exercises that are in this video, it's not medical advice, it's just for educational purposes really. Now when we're looking at back pain and causes of back pain, majority of the time it's caused by muscle spasms. The muscles either side of the spine, if you put the spine down the centre, either side and across around the outside here towards the top of the hips, is where the big muscles sit that support the lower back. And those can go into spasm. That's often what causes a sudden onset of back pain when it's not really had any trauma to the area. So you hear stories of people, for example, reaching down to pick something up from the floor, something light, like they've dropped their phone on the floor, and their back suddenly goes. That's often caused by muscle spasm, not by any structural damage to the back. Now when we've got muscular related back pain or muscle spasms in the back, what we need to try and do is get some blood flow to those muscles. That's how you get them to settle down. So these exercises are really nice ones to be able to do at home in those acute stages to try and get it to settle down a little bit and then get you moving in the right direction. So the first exercise we're going to look at is a bridge. So to do this exercise, you need to lay on your back. Now, when you're doing a bridge exercise, what you need to do is have your hands by your side here, and then the first thing you're going to do is have your knees bent and your feet flat on the bed or the floor. And then you're going to engage your abdominal muscles to flatten your lower back onto the floor or onto the bed. And then from there, you're going to follow that movement and lift the hips up to the top, keeping those abdominal muscles engaged, squeezing the buttocks, pausing for a second, and then slowly lowering back down, keeping the abdominal muscles engaged. What you don't want to do is to go too far, start arching the back, because that's just going to aggravate it. Just go engage the abdominal muscles, lift the hips up to the point where you've got a straight line from your shoulders all the way to your knees, and then slowly back down again. You just want to do between 8 and 12 repetitions of these, depending on what your pain levels are like. Everyone's pain levels are going to be slightly different, so just do them nice, slowly and controlled, and just do as many as you can comfortably. Because we're not building strength with this, you're more just looking at getting blood flow to the area. Okay, that's the first exercise. So the next exercise we're going to look at is knee side to side or knee rolls. So to do this exercise, you lay on your back with your feet flat on the bed or on the floor. You're going to bend your knees and bring them together, and you're going to bring your feet together as well. Engage your abdominal muscles to flatten that lower back against the bed or the floor, and then what you're going to do is slowly roll your knees from one side, keeping them together, and then slowly roll them to the other side. Just go as far as you're comfortable with, from one side to the other. Keeping those abdominal muscles engaged, and just working with the range of movement that you can comfortably. And similar to the bridge exercise that we looked at before, if you're aiming between 8 and 12 repetitions to each side, that's perfect. You're just looking at getting some blood flow to the back to try and settle it down. Lovely. And the third exercise that we're going to look at is the cat-camel or cat-cow exercise. So for this one, you need to go onto all fours. Now, once you're on all fours, you want to have your feet, your knees shoulder width apart or hip width apart, and your hands shoulder width apart. And what you're going to do is you're going to slowly drop your stomach down and arch the back backwards. So you're going to drop the stomach down, have an arch in the back here, and then just pause for a second, and then go the opposite direction. So you're going to draw the stomach in and arch the back like so. And then just alternate between those two positions. Dropping the stomach, arching the back, and then pulling in the stomach and arching the back upwards towards the ceiling. And just go through, again, comfortable range of movement It's more about getting the blood flow to the area and getting the blood flow to the muscles in the back. So even if you can only manage a small range of movement, say like this, that's absolutely fine. Just do it slow and controlled, and just do as many as you can comfortably, going through as much range as you can. So if you have an acute onset or a sudden onset of lower back pain, the chances are it's muscular, but it's best to get it checked out. If it is muscular related, then these exercises can definitely help start getting on top of it. If you found this video useful, please like, share, subscribe, and comment on it. Let me know what else you want to see in the future. But if you found it useful, please leave a like and subscribe. It really helps get this out to as many people as possible. Thank you very much for watching, and I'll see you in the next video.